You got both computers on plugged into?
Yeah.
Okay. I'm gonna go outside there for a little bit then.
All right.
So your thing's gonna run from like 2 to 3-ish or less?
Probably 3, maybe.
Yeah, longer, whatever. Do what you have to do. You wanna run in and take a shower after that? Oh my goodness.
Hello, Eve.
Oh,
Okay. So if you want to turn off your camera, you can. Okay, so let's look at chapter 6 is conversions between measurement systems. And we talked about page 115 with the nitroglycerin, because that's really important. Nitroglycerin is kind of weird. It comes in 3 strengths. So it's NTG, SL, and the grain 1/200 or 1/200th of a grain is 0.3 milligrams. And the GR 1/150 or 1/150th of a grain, that one is 0.4 milligrams. And then the grain 1/100 is equal to 0.6 milligrams. Okay, and the way that you convert this is let's say you wanted to know milligrams, and you're using 60 milligrams to 1 grain. 60 milligrams over 1 grain times, and let's do the 1/200. 1 grain over 200. Okay, so now the grains are going to cancel, and that tells you to take the 60 and divide it by 200. And when you do that, 60 divided by 200, you get 0.3. So one of the things to remember, these are the 3 strengths, and the number on the bottom gets lower from 200 to 150 to 100. But the milligrams go up from 0.3 to 0.4 to 0.5 because you're multiplying, or you're actually dividing by a smaller number, so your answer is going to be larger. Okay, does that make sense?
yeah.
Yes.
Okay, good. All right, so that's the nitroglycerin. Let's look at phenobarbital, because phenobarbital is another weird one. And phenobarbital on page 107, this is one of the oldest anti-seizure medications around. There you go. And it says to use 60 milligrams per grain. But it also comes in strengths based on 64.8 milligrams per grain. Okay, so this is the way the bottle looks. So then 1/2 grain is 32.4 milligrams, okay? Because that's how they used to do it a long time ago. It was a grain or a 1/2 grain or a 1/4 grain of phenobarbital. And the 1/4 grain was going to be whatever 32.4 divided by 2 is, which is 16.2. Okay, but when we're doing this type of calculations, like we do over on, where is it? Page 115, number 16. It says a prescription is written for phenobarbital grain 1/4. The medication stock bottle measures phenobarbital 30 milligrams per unscored tablets. Okay, so what strength in milligrams should be used for the dose? And is this the correct medication stock bottle for the prescription? Now it's an unscored tablet. What does it mean when it says it's unscored? So this is what a tablet would normally look like, something like this. And if it's scored, if I can draw that better, it'll have a line down the middle. Okay, does that make sense?
Yes.
Okay, so if it's scored, that means you can cut or break in half. So when it says it's unscored, that means you're not supposed to cut it, or they don't recommend that you cut it. Now, if you need to find out if it's actually enteric coated so that it dissolves in the small intestine instead of the stomach. If it's enteric coated, then you shouldn't cut or break it because the whole thing's going to dissolve in the stomach. Or if it's a delay release tablet, you don't want to cut or break it. But in this case, you know, saying that it's unscored usually means you shouldn't cut or break it. So what strength should be used for the dose? Well, right here we see that the 1/4 grain is usually 16.2 milligrams. If we have a bottle like this from a company that doesn't use apothecary notation, then they're just using 30 milligram tablets. Is that the one that you would use? I would say no, because it deliberately says unscored tablets. So you could use a half a tablet, which would give you 15 milligrams, because, you know, it says to use 60 milligrams per grain. So 1/4 of a grain. Oh, okay. 1/4 of a grain. Okay, so remember we're going to do the 1 grain over 4. 60 over 4 is 15 milligrams. Okay, so we would use 15 milligrams unless we're going to have the bottle from the company that uses the apothecary notation, which is 16.2. I'm not going to give you a question like this and then give you 2 answers, one 16.2 and one 15 milligrams, because either one is actually correct. You know, and then I'm going to make you guess which one I'm really looking for. I don't do that type of problems. I don't do that. So I would say no, you can't use that medication for this. Okay. Let's look at page 115, number 9. It's codeine. GRSS with the line over it. Now, what conversion are we using for codeine? If some of you guys remember, I drew the clock last time. Or you could go to page 107 and it shows you codeine. And then it tells you what conversion factor to use. And it tells you, go ahead.
30, correct?
Yes. So it tells you that to use 60 milligrams per grain for codeine. So 60 milligrams in 1 grain. And how many grains do I have?
Half. Yeah. 1/2.
Yes. Because I have a half of a grain, right? So now the grains cancel out And that gives me 60 divided by 2, which is
30 milligrams.
30 milligrams. Good. Okay, let's look at number 6. Now it wants us to go from grains to grams, but how many grains do I have?
7.5.
Yes, 7.5 grains. And does it tell me which drug that is?
No.
No, so we don't know which drug it is, so we can't go over to page 107 to see if it's aspirin, Tylenol, or iron. So we're going to use 60 milligrams
Okay.
per 1 grain.
If it's not tell us the name of the medicine, we should use the 60.
Yes. So
Okay.
most purposes, we're going to use the 60, but you'll keep finding Tylenol, Phenobarbital, aspirin, and iron on tests because they want you to know the exceptions. So, you know, that's why I always make sure we go over those exceptions. But if it doesn't say, then use 60.
Okay.
So we have 7.5 grains. I'm going to go right into decimals. And we could use 60 milligrams in 1 grain, but then we're going to have to convert it to grams,
Gram.
right?
Yes.
Okay. So how would we want to know how many grams, right? 1 gram is, we know it's 1,000 milligrams, right?
Yes.
And we have 60 milligrams to 1 grain, right?
Yeah.
Times what?
This one. The answer, if in the milligram, it will be 450, and the gram, it will be 0.45 gram.
Okay, so let's see what we get on the top. 60 times 7.5, and we get 450 and
450
over 1,000.
1,000.
Okay, so you're saying that if we were converting to milligrams, we'd have 450 milligrams, right?
Yes. Yes.
Exactly. Okay. So now we have to divide that by 1,000 to get our grams because we're going to convert it to grams instead of milligrams. So 450 divided by 1,000 on my calculator.
0.45.
0.45 grams. So G or GM is always going to be gram, but GR is going to be grain.
Grain.
So we want to be careful with that because a lot of times I'll ask you to tell me how many G's, and the answer I get will be grains. So that's not good. Okay. Let's do a few more of these that are on your post-test. Let's look at number 28 on page 118. And number 28 says a physician orders acetyl salicylic acid, 325 milligrams. What is acetyl salicylic acid?
I think it's Tylenol, maybe?
No.
No.
Acetyl salicylic acid, ASA.
Aspirin. No, acetyl.
Aspirin?
SAL. Yeah, I always have to remember where the Y is.
Aspirin, right?
Yes, it is. Okay. I have such a hard time writing on this notepad because it's actually, if I press too hard, it's like squishy. All right, let me let somebody in here. Okay, so for aspirin, what are we using for a conversion factor?
65, I think,
Yep.
for the grain, yeah. Yes, 65 milligram
Yeah.
per grain. Yeah.
And so it says that they're ordering 325 milligrams of aspirin, right?
Yeah, divided by 65.
Okay. So we want to know how many milligrams. 65 milligrams. Oh no, they ordered 325 milligrams. We need to know how many grains that is, right?
Mhm.
Okay, so we're going to go 1 grain over 65 milligrams, and then multiply it by 325 milligrams. You can put it over 1 to make a decimal or a fraction out of it. And that tells us to take the 325 and divide it by 65. And what do we get?
25 divided by 65. 5.
Yep. So it says available are GRV tablets. What is GRV?
5 grams.
5 grains.
Yes, 5 grains. Good. So is that the tablet that we need for that?
Yes.
Yes. Okay, let's look at number 29 on that same page. And it says a child is to receive Benadryl elixir. Do you know what an elixir is?
No.
An elixir is like a cough syrup, but instead of being thick and syrupy, it has more alcohol in it and it's thinner. Benadryl elixir is a thin syrup, and it might have some alcohol in it. A lot of the ones they make for kids nowadays, they're taking the alcohol out, but if it's thin, they still call it an elixir. So then it says the parent, 7.5 milliliters. The parent needs to give this with a teaspoon. How many teaspoons should the parent give per dose?
Teaspoon,
5 mLs and 1.
5. 1.5 teaspoon.
Okay, so if we want to know teaspoons, our conversion factor is 1 teaspoon to what?
2
5
mil.
ml.
5
5
mL.
mLs. So the mLs are going to cancel. 7.5 divided by 5 is 1.5 teaspoons.
Teaspoon.
Okay, you guys all have your books by now, right?
Yes.
Yeah.
Okay, good. Look on page 120 and let's look at the pretest number 2. And this is for chapter 7.
Prescription. Triglyceride, 4 milligram. Okay.
Now this is a situation that actually occurs, so I want you guys to pay attention to this one. It says it's a prescription for nitroglycerin 0.4 milligram sublingual. Now what does the next thing mean?
Every 5 minutes,
Every 5 minutes, and how long are they supposed to do that?
3 doses. PRN. What was that?
Yeah, so they're supposed to take it for 3 doses as needed. So if they take 1 dose, they wait 5 minutes, take another dose, wait 5 minutes, and then take another dose. That's like 10 minutes, isn't it? Or maybe longer that they've had this chest pain. So then it says if no relief, call 911 because it's an emergency situation. So this is for chest pain, and it opens up the arteries taking blood into the heart. So it helps if the patient is having chest pain due to narrowed arteries. So if the arteries narrow, then the patient could have a heart attack because they're not getting enough blood flow. So then it says in stock, nitroglycerin 0.4 milligram SL tablets. So what does SL mean?
Sublingual.
Sublingual, which means what?
Under the tongue.
Under the tongue, good. So are they supposed to put it under the tongue and swallow it?
No.
No, they leave it under the tongue because it absorbs through those little capillaries under the tongue. Okay, so what would your label directions say? Place, we always have to have a verb with label directions. So we're going to say place, how many tablets?
It would be one, right? Yeah.
Yeah, 1 tablet under the tongue. Every 5 minutes for 3 doses. If no relief, call 911. Okay, so when we are typing directions for a prescription, we always want to have a verb. We always want to have the number or quantity of whatever we put in that bottle. So it could be a teaspoon of liquid, or it could be 1 tablet or 3 tablets, or it could be 1 suppository. Then we want a route. Okay, so even if they don't give the route, but we know it's a tablet and they're going to be taking it by mouth, then we're going to put by mouth. So it could be sublingual, it could be PO, it could be IV. Okay, so the verb is always going to be give, or take, or place, or instill, or swish and spit. Okay, so we want the verb, we want the quantity, we want the route, and then we want the time factor. So that could be Q4 hours, it could be Q5 minutes, but we want to write it out for the patient because patients don't know what that means. And then we want, okay, so if they don't put what it's for, then we don't put what it's for. For instance, if it doesn't say for chest pain, then we're not going to put chest pain. Okay, so we're going to look at some prescriptions. Let's see, where are we going here? It's a very long pretest, and you don't have to do the pretest. Let's look at page 127, and this starts the prescription. They're medications ordered by prescribers in outpatient settings. If they're in the hospital, they're called medication orders. In outpatient, they're called prescriptions. Now, they can be handed to the patient on a piece of paper. That's the actual prescription. We sometimes call it a script. We call it an RX. Okay, so that is the outpatient one. So outpatient means the patient is not in the hospital. And if it's an ambulatory pharmacy, to ambulate means to walk. So they're basically walking in. They might be in a wheelchair, but we're still considering them ambulatory because they don't sleep at our pharmacy, you know. Like in a hospital, they stay there. So if they're going home as soon as they get their prescription, then it's outpatient or they're ambulatory. Okay, so it's important that we're able to read and interpret these things accurately. That's why it's important to learn those abbreviations from chapter 1. Every order must be reduced to writing as soon as possible, and the pharmacist must transcribe any verbal orders. Now, some states allow pharmacy technicians to take prescriptions over the phone. Like they'll say, this is Dr. So-and-so, my patient's Mary Smith, and she needs labetalol 200 milligrams once a day. And I want to give her a 1 month supply and give her 11 refills. So I could, you know, very easily write that prescription out. But in California, we're not allowed to take a verbal order, whether it's by the phone or if the nurse is standing in front of us. All of those go to the pharmacist. So when I would get a phone call that says, this is Dr. So-and-so with a new prescription, I would say, let me have you speak with my pharmacist. I'll place you on a brief hold, and then I'll tell them that there's a new prescription and a doctor on the line. Now, also in California, the weird thing is that from the doctor's office point of view, it does not have to be a doctor that phones in that prescription. In fact, California state law says it doesn't even have to be a nurse. So it's really weird. I would hear my pharmacist, like I'd get a phone call and the person sounded kind of young. I have a new prescription. Okay, let me get you my pharmacist. I'll place you on a brief hold. And then the pharmacist would get on the line and I would hear them. One in particular, I remember my pharmacist, Bruce, and yes, I named my dog after him. He had the person on the phone from the doctor's office, and I remember him saying, okay, is it Xanax or Zantac? Okay, neither one of those comes in 50 milligrams. Call me back when you find out. And he hung up on them. And I said, who was that? And he said, I don't know. It sounded like the doctor's 12-year-old niece or something. So he was very disgusted that the doctor's office would have someone phone it in that didn't know the difference between Xanax and Zantac and didn't know that neither one of them come in 50 milligrams. So that was an interesting call. So in California, you do not have to be a doctor or a nurse to call from the doctor's office. They can have anyone they want call in. But in cases like that, our pharmacist would not take the prescription because he could tell that this person wasn't somebody who knew what they were doing there. Yes?
So is it easier? Do they do e-script or email now? Something easier versus having to do everything on the phone?
Yes. In fact, we're getting a lot more e-scripts. I'm going to write this down.
Okay.
Which is computer
Right.
RX entry. Okay, so let's say that we're Kaiser Pharmacy. When a Kaiser and a lot of HMOs, when they have a doctor write a prescription, they don't actually write it on a piece of paper. They can if they want to, and sometimes they do, but most of the time they don't. They enter it into the computer, and then they tell whichever pharmacy you say you're going to pick it up at in the Kaiser system, they'll tell them to fill it, or they tell them that there's an order in the system. Now, they won't actually fill it until you go to the pharmacy and check in. Once you go to the pharmacy and check in, then they'll start filling the prescription. Does that make sense? Because they don't know if you actually want it or not.
Right.
Okay. Because a lot of people will go see their doctor and either they don't have money to get prescriptions or they just decide, you know, oh, I don't know, I'm going to wait on that.
Yeah, or they don't know how much it actually costs because some can be expensive.
Yes, exactly. And something like Prevacid, Prevacid, when it first came out, I don't even know if it's available in generic now, but at the time it was like $3 a pill. So 30 tablets, the cash price was $90.
Yeah.
And patients would then have a copay of like $10 or $20, and they'd be like, $20 copay, that's way too much for 30 tablets. That's ridiculous. And they didn't want to buy it. There were some medications that were upwards of $6,000 when the first AIDS medications first came out. Some of them were $6,000 for a 1 month supply. And if the patient had a copay of like $50, they would think that was a lot of money and not realize what
Right.
that their insurance was actually paying a large portion of that price. Okay, also on page 127, the pharmacist is ultimately responsible for dispensing the medication as ordered. As a pharmacy technician, you have the training to perform most functions in the pharmacy. So we need to stay current with new indications for older medications. Indications is the condition that they're taking it for. For instance, there's a drug called terbutaline. The brand name is Brethine, and it's used for asthma. But what they discovered in giving it to pregnant women with asthma was that it would slow down or stop their labor. So then they started using terbutaline off book. So it's called an off book use. Okay, so that's where the medication is used for a condition that it was not originally intended for. Now, if the drug companies don't specifically do research for that thing, they cannot tell doctors, you know, to use it for that. They can't advertise it for that. But what happens is over time, you start hearing about these off-book uses. And in the case of terbutaline, for a while there, we weren't allowed to use it to stop early labor. But it just kept being used for that. So eventually, you know, it's called an off-book use. Doctors are allowed to prescribe medications for off-book uses. But drug companies are not allowed to advertise it for that use unless they've done the studies to show that it works for that. So we have evidence that it works because it's been used in hospitals for that for years, but they're not allowed to advertise that they use it for that unless they want to go through the whole process of getting it approved for that use. Does that make sense?
Yes.
Okay. So like giving children coffee for ADHD because caffeine is a stimulant, and in children that truly have ADHD, stimulants will slow down their thinking process actually and keep them on task. So that's an off-book treatment for ADHD. And I have a niece with 6 kids, and one of her kids was severely ADHD. You could not get him to sit down and complete any work. And so she would give him a little bit of coffee with a lot of milk and put a spoon of sugar in it, which you would think, why would you give sugar to a kid that's hyperactive? But with the coffee, it actually calmed him down, and that was the only way she could get him to do homework in the afternoon. And the weird thing is, with some kids, these stimulants act the opposite. So he was able, you know, to sleep a couple hours later without any problem. So that's, some things are kind of weird that way. Okay, so let's look at the pharmacokinetics and pharmacotherapeutics. Knowledge of pharmacy includes pharmacokinetics. So the word kinetic indicates movement. So pharmacokinetics are the movement of drugs throughout the body. And pharmacotherapeutics is the therapeutic uses and effects of drugs, whether they're beneficial or harmful. The field of toxicology studies the adverse effects of chemical substances on the human body. Now, when we hear chemical substances, a lot of people tend to think of drugs as chemicals and anything bad for you as a chemical, and the word chemical becomes like the bad guy to them. I have a very sweet cousin who is not very science-minded, and she posts on Facebook all the time things like, I don't clean my counter with chemicals, I use vinegar. And so I just couldn't take it anymore, and I posted the chemical formula for vinegar and told her it's a chemical, and she hasn't spoken to me since then. Vinegar is an acid, honey.
Yeah.
I wouldn't use it on your granite if I were you, okay? But no, it's this magical nature thing, so it must be harmless. So toxicology, our very first poisons came straight from plants, okay, straight from plants. And you know, things like poison ivy and poison oak you shouldn't go into and touch. So I always want to clear up right in the very beginning that, you know, nature is not all good and wonderful, and science is not all bad and unnatural. You know, nature is science. Okay, so the toxicology studies the adverse effects of all kinds of chemical substances on the human body, whether they're considered quote unquote natural or not. So it's important to learn the normal dosage range for medications so you can check your calculations to see if your answers make sense. And the difference between the therapeutic or desired effect and the toxic harmful effects have to be considered, as well as drug-drug interactions, drug-food interactions, and drug-disease state interactions. So what does a prescription indicate? There's one thing here. Okay, so there's a difference between the therapeutic effects of a drug and the harmful effects of a drug. So let's say that the therapeutic effect begins at 50 milligrams. If the harmful effect begins at 200 milligrams, then you have a pretty good window there, right?
Yeah.
And this is called the therapeutic index. But in some drugs, the therapeutic index is very small. And instead of the difference between 50 and 200, it's more like the difference between 50 and 70 milligrams. So if you took 2 tablets, you would be giving someone a harmful dose. So this is a narrow therapeutic index. Okay, is that making sense?
Yes.
Okay. So let's look at the parts of a prescription right now, because I know this is math, but when we're dealing with medicine, then math and we're looking at a lot of different parts of math with especially, outpatient and inpatient pharmacy. Okay. Prescription is a means for a physician or other health professional to provide the information needed by the pharmacist to dispense the desired medication for a patient in an outpatient setting. It's an order written for a specific person by a medical professional licensed to prescribe for a specific condition. The rules about who may prescribe vary from state to state, so the statutes of the state practice determine the legalities of prescription writing. As a legal document, the prescription indicates the medication desired and the directions for use. Okay, so look at your tech notes. Legally, the physician's DEA number, Drug Enforcement Agency number, must be on a prescription if it's written for a controlled substance. And also, if you work through the prescriptions, an understood meaning is that if a tablet or capsule is ordered, the route of administration is by mouth, PO, unless otherwise indicated. Okay, so we want to make sure that the instructions are clear when we type a prescription. We're going to begin oral prescriptions with take and always state the number of tablets, capsules, or millimeters as opposed to the strength. For instance, if the prescription is for 500 milligrams, and the medication comes in 250 milligram tablets, you're going to type take 2 tablets, not take 500 milligrams.
Okay.
Okay, so let's look at this as if it were a prescription. So the prescription is going to say something like, okay, so here is the prescription. And then it's going to be signed by the doctor. Refills are 0 because why would refills be 0 on an antibiotic?
They're only supposed to be taken a certain amount of time.
Okay, but what if they still have the infection?
Right there it says 10 days. So I'm guessing that's all the doctor ordered was 10 days worth.
Okay, why should they not even ask for a refill?
Your body will get immune to the medication?
Is there like a superbug to it or something?
You're going in the right direction there, definitely. Okay, so what's happening is if they've taken this medication, how many times a day is it?
4 times a day for 10 days?
Yeah, so the QID is 4 times a day for 10 days, and they still have that infection. Is this drug working?
No.
No.
No. So in that case, they need to go back to the doctor and get a new prescription, maybe for something different. It's kind of rare that a doctor would say, well, you know what, let's just give it a little more time, take it for 10 more days. So that usually doesn't happen, especially if the infection is not even starting to get better. They're going to switch it to a different drug. So that's why you won't usually find refills on an antibiotic unless it's something that the patient gets recurring. Okay, so let's say that, they get a bladder infection, and they take the medication for however many days, and then a few months later they get another bladder infection, or even 2 months later, because the condition of their bladder is that it's constantly getting infected. But if the medication works, then they may say, okay, I'm going to give you 2 refills, but don't get them right after each other.
Right.
So I've seen that a few times where they'll have a medication for a bladder infection with a refill or 2, because let's say they always get it in the winter and then they always get it in the summer, but they don't need to see their doctor more than once a year.
Right.
Okay, so go ahead.
I took this medication. I did not like the side effect.
Yeah, I've taken medications like that where the side effect is so bad that you're like, you know what, I don't even care that it makes me feel better. I'm just not taking this stuff.
Right.
Side effects are not worth it. So, I'm not somebody who promotes treating everything with medications, definitely, but I think we need to come from knowledge rather than rather than saying all drugs are bad.
Right.
Okay, and you guys know, if you're in pharmacy or nursing, you know this. Okay, so then how would we write this on the bottle? Okay, so we would have the patient's name, the doctor's name. We have to have the date. And we have to have the directions, which is the SIG or the directions. So we're going to put take. So now if if Keflex only came in 250 milligram tablets, we'd have to give them 2 tablets, right? But then we would also have to give them twice as many so that they could take 2 tablets 4 times a day for 10 days. But in this case, if we have 500 milligram capsules, and Keflex comes in capsules, we're going to put take 1 capsule. By mouth 4 times a day for 10 days. My writing is very bad. Okay. So we're going to write that on the prescription, on the bottle that we give the patient, not the prescription, but on the dispensing bottle. And now we're going to put, we might give them cephalexin, which is the generic. Cephalexin, 500 milligram caps. And then we're going to put generic for Keflex. And we're going to put number 40, and we're going to put 0 refills. Now, in California, this program is automatically going to give a description of the drug. And it might put DESC, put oval, orange, yellow caps. Okay, so let's see, we've got the date, we've got the patient name, the doctor name, the directions, the name of the drug and strength, whether it's a generic, how many refills. So in total with all of this, we have to have a prescription number too. So it'll have a prescription number on it. And so that's the number that it's stored in the computer under, is by the prescription number. So then this is the label for the bottle. That the patient gets. And it might also say Wyeth or whoever the drug company is that makes the drug. So in California, the law says there has to be 11 things on the prescription label. So I don't know if there's 11 here. Let's see, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Okay, we're good. We have 12 things on this label. because the SIG, the directions, is one thing there. Oh, and generic if a generic was substituted. Now, if they actually wrote the prescription for cephalexin and did not put the word Keflex, then we would not need to put generic for Keflex on the bottle because they ordered cephalexin, we gave cephalexin. Does that make sense? It's only when we substituted generic that we put generic for. Okay, so if you go over to page 128, there are the actual parts of a prescription, not a label for the patient, but the prescription itself. So it'll have the prescriber's name, the prescriber's office address and telephone number, and the date that they wrote it, the patient's name, the patient's address, and the patient's date of birth. Now, California says they can put their age instead of their date of birth. If it has their age, then we write the date of birth because the date of birth is an identifier for us, especially if we have more than one Kimberly Lopez in our pharmacy as a patient. The date of birth will tell us which one it is. Mm. And then the RX is a superscription. It's a symbol that means take this drug. The inscription is the medication name, dosage form, strength, and metric quantity. And in California, it has to be metric. So we can't tell them to give, 47 grams of liquid. The subscription is the instructions for the pharmacist on how to compound, and that's if needed. So most prescriptions in California will not have a subscription because we don't have to compound most prescriptions. And then the subscription, okay, then the signatura or SIG is the directions for the patient, how to take the medication, how much, when, and for how long. And then it will say if substitution is permitted or DAW. DAW means dispense as written, which usually means brand name only. But if they write a generic name, dispense as written is generic, right? So this is something that I've actually had arguments with patients over, like your insurance company will not pay for Keflex, even though the doctor put DAW1, which means dispense as written, because he did not write Keflex, okay? The other one is DNS, which means do not substitute. So again, if the doctor writes Keflex and there's a DNS on there, then we have to give brand name Keflex. But remember, if they write the generic name and says do not substitute, then we could give any generic. We're not substituting. Okay, and then the number of refills and the prescriber's signature has to be on the prescription as well. If it's a controlled substance, we need the doctor's DEA number on that prescription, and it'll usually be up at the top. Okay, so those are the elements of a prescription, and then the elements of a label. Now the label a lot of times won't have the doctor's phone number on it. It won't have the patient's phone number on it, but it has to have the pharmacy phone number on it. So the name and phone number of the pharmacy, the prescription number, the date it was filled, the prescriber's name, the doctor's name, the patient's name, the drug name, strength, dose, and quantity, directions for use, the manufacturer's name, the pharmacist initials, and the expiration date, and then any refill information. So the ISMP recommends the use of numeric rather than alphabetic characters on prescription labels. Therefore, use numbers such as 1, 2, and 3 on prescription labels as opposed to spelling out ONE or TWO. In its quest to reduce medication errors, the ISMP also recommends the use of numbers over ambiguous terms such as twice daily. This should be written take 2 times a day. Okay, so now there's a tech note. If the prescription is written for a brand name and substituted with generic, you must put generic for brand name with the specific brand name entered on the label. Mm-hmm. So look on page 129 and The prescription interpretation is how one would read the prescription without the use of abbreviations. The label directions are written for the patient in language that is easily understood. So if you look at page 129, example 7.1, we have Zoloft 50 milligrams, and that happens to come in a tablet. And they wrote it for number 30, and the directions are 1 tab POQAM. So then we would actually write this out as take 1 tablet by mouth every morning.
Mhm.
So if they don't put a verb, and there's never a verb written on the prescription, but we have to put the verb in there like take or give. Walgreens was very interesting because when I had a prescription for my dog, you know, they wanted the dog's date of birth. And then it said, and they realized that the dog was not 12 years old. So anyone under the age of 12, their prescriptions will say, give the name of the person in quotation marks, give Manny 1 tablet by mouth 2 times a day. So if it's a child or any, you know, living being under the age of 12, it's going to look like that instead of this saying take if it's an adult. Okay. And that's something that Walgreens computer did automatically. We didn't have to do that. So I don't know if they still do that because I haven't gotten a prescription at Walgreens for a child in years. Okay, the second one, example 7.2, mycostatin oral suspension. Mycostatin is a brand name for nystatin, which is an antifungal. And it says 60 milliliters. And then it says AGIT for the SIG. SIG are the directions for the patient. So the SIG is always going to be usually abbreviated for us, but then we have to actually spell them out. So AGIT, what do you think that means?
It says shake medication.
Yeah, but what does AGIT stand for?
Agitate.
Agitate, good. So you're going to agitate okay. So you're going to shake it and then swish and swallow 5 milliliters every 4 to 6 hours. Now it doesn't say by mouth because how else would you swallow it?
Mhm.
So we usually tell these types of prescriptions. This is for something called oral thrush, which is a yeast infection in the mouth, and it tends to accumulate real close to the gum line in the cheek area. So that's why they want you to shake it up really well, take a teaspoon and swish it around the whole mouth like you would use mouthwash. And then because it's nystatin and it's also going to work internally against yeast, which is a form of a fungus, then the patient can swallow it. But I've also seen this direction as swish and spit or swish and expectorate. So then this prescription should be dispensed with a measuring device appropriate for 5 milliliters. How much is 5 milliliters in household measures?
1 teaspoon.
1 teaspoon.
Yep, 1 teaspoon. Okay, so your next several prescriptions are similar to that, but look on page 131, number 4.
Okay.
And it says prednisone 10 milligrams, number 40. Now, prednisone is a steroid. A steroid brings down inflammation, but it's also a very strong drug. So what they usually do is they start out with a high dose and they taper it off as the patient takes it. So they're going to give 40 tablets. And then the SIG says 1 tab POQID X4D 1 tab PO TID X4D, 1 tab PO BID X4D, and 1 tab PO daily times 4. So what exactly does that mean?
Take 1 tablet by mouth 4 times a day for 4 days. Take 1 tablet by mouth 3 times a day for 4 days. Take 1 tablet by mouth 3 times a day for 4 days. Take 1 tablet by mouth 1 times a day for 4 days.
Yep, that sounds exactly right, except we're going to put then at the end of every direction. Okay, now, will this fit on a medication label very easily?
No.
Especially since they're making us put the route, fill out tablet. Okay, so what we can sometimes do is there's a notes area where a very long SIG is automatically going to say, take as directed, see directions. And then the paperwork that comes with it, we will actually flag it to the bottle. So here's the bottle of medication with its label on it. And if it says see directions, we're going to take this piece of paper and we're going to write all this stuff out, which is probably going to be like 8 lines. And we're going to flag it onto the label with tape. Okay. And we'll actually tape it on there so that it's attached to the bottle. They won't lose it, but it doesn't take up as much space on the label that way. So this is going to say take 1 tablet by mouth 4 times a day for 4 days, exactly what Ian actually said on there. So this is called a decreasing dose. If I could spell. A decreasing dose, it's also called a tapering dose. And this is so that the patient doesn't go through rebound swelling by abruptly stopping a steroid, because that can sometimes happen. Okay, so then let's look at page 135, number 11. Now this is just the opposite. This is a drug called Neurontin, 600 milligrams, number 50. Neurontin has a few side effects that are not necessarily harmful, but they can be very annoying for patients. One of them is it can affect their sense of taste or smell. So they're getting 50 tablets, and the SIG is 1 PO daily times 5 days, 1 PO BID times 5 days, then 1 PO TID. Neurontin is an anti-seizure drug, but they use it a lot. One of its off-book uses we talked about is for pain due to nerve conduction or problems with nerve conduction. So they use it for pinched nerves. They use it for things like fibromyalgia, which is considered overactive nerves. And the generic name is gabapentin, and it works on the GABA, which is gamma-aminobutyric acid, and the GABA receptors. So it basically tells the brain that it's not getting these pain signals as much as it thinks it is. Okay, so because of the side effects, they start out low and then they increase the dose. So it's 1 tablet every day for 5 days, then 1 tablet twice a day for 5 days, and then 1 tablet 3 times a day, and they're going to leave it at that dose for the rest of their course of therapy. Okay, so we see that quite often. Any questions so far?
No.
No.
So one of the things you'll see sometimes is as tolerated, which means that if they don't have bad side effects, then they can keep taking it. some drugs cause upset stomach, some drugs cause sleepiness. So a lot of the as tolerated depends on how much the patient can handle of the side effect. Okay, the bottom of page 135, it's talking about a medication order. A medication order is a way of providing the same information as is found on an outpatient prescription, but it's used in an inpatient environment. Okay, so the outpatient prescription is written for either a number of doses or the length of time of therapy. So for instance, here on this prescription up here, let's say that they forgot to put times 40. Would we still be able to fill this prescription without it?
Yes,
Why?
because you can multiply 4 times a day times 10 days.
Yes, exactly. So it has a duration of therapy, which tells us how many capsules to give the patient. Now, if they put times 40 and they didn't put for 10 days, if they take it as directed, how long would it last?
Also 10 days.
The thing.
Yes, it's still going to last 40 days, or 10 days, I mean, exactly. So outpatient has to have either the time limit, it has to have a time limit, either the quantity or the length of therapy, okay? If it doesn't have one of those things, we have to call on it. But for an inpatient, it tells the health professional which drug or drugs should be administered, how to administer them, the strength of the medication, and the frequency that should be given in an inpatient setting. The medication order contains the date, patient name, etc., the signature of the professional. Although only recommended in emergency situations, medication orders may be verbally communicated. However, for legal purposes, each order should be transcribed into writing. These days, we have something called an electronic health record. So this includes things like an EMR, which is the medication administration record. So I haven't worked in hospital for longer than 5 years. So I've seen some drug orders, but I haven't dealt with it myself as far as written orders. We still use written orders for chemotherapy, and they have to have an actual signature by the doctor. But then they get put into the electronic health record. So if the doctor orders it in the computer, then they don't have to have a piece of paper that they sign, because they're using their login and password to log in and order it for that patient. So it gets listed that way. Okay, so now, having said that, they don't have to put the length of time because it's only going to be given to the patient as long as they're in the hospital, right? But if it is an antibiotic and the patient's in there for 6 weeks, they're not going to continue that same antibiotic for 6 weeks. So they usually have a start date and time. And an end date and time. In other words, if they're still here in 3 weeks, we're going to stop this in 10 days. Or however long. They're going to put an end date and time so that they don't just keep taking it forever and ever. Okay, so here's some of these things. Now, there is a tech alert. Even though in most inpatient pharmacies, a pharmacist enters medication orders into the computer, the pharmacy technician still has a responsibility to check as he or she is filling orders and report any concerns to the pharmacist. We look at these things in the computer And the way that the way that the drug order works in a hospital, for most hospitals, because I've talked to people that have worked in other hospitals, is that the doctor will put an order in the computer system. The pharmacist has to verify that order. And in children's hospitals, each order has to have 2 pharmacists verify. So there's a verification, then there's a second verification. So that can take some time because my pharmacists are literally verifying orders all day long. So it could be a few minutes before they get to your patient's order. And then they verify it in a way that it will produce a label that I, the technician, can read. Having said that, there's been several times when I've looked at something and gone, we don't have this in the nasal spray form. You know, we only have it as drops or whatever. So then I'll hand it back to the pharmacist and say, do we need to order this, or do you want to, you know, see if you can change it? So I've also had orders that were written for a drug 0.004 milliliters in, you know, 5 milliliters of normal saline. So if I'm making an IV, I'm like, I'm not going to be able to measure that. 2 decimal places is the most accurately that I can measure. So then what I'm going to do is like put 10 times this amount. So I would put 0.04 milliliters in 50 mLs of normal saline. So now I'm going to dilute it, and then I'm going to pull out 5 milliliters and give that to the patient, because I can measure this accurately. I can't measure that accurately. Does that make sense?
Yeah.
Okay.
Yes.
At the very top of that, right there, is 0.04 milliliters. Am I going to be able to divide that by 10 and dispense it? No, I am not. So in that case, that's how we would do that. Okay. So it's called a dilution. Now the rest of the other 45 milliliters are going to be thrown away into the pharmaceutical waste bin, and they actually get burned up later. Okay, so in outpatient pharmacies, technicians enter the orders into the computer, so we have to be able to read them. In inpatient pharmacies, most hospitals in California that I know of will have the pharmacist check and verify those orders that the doctor puts into the system. Sometimes a nurse could put it in. It depends on if the nurse is a nurse practitioner or, you know, something like that. Okay, so let's look at this medication profile on page 136. Okay, so this is in a hospital, and it's a list of physicians' orders that the doctors write. So keep in mind, if they write it by hand, it's going to be kind of messy. If they put it in the computer, you'll be able to read it like this. So it gives the patient's name, it has their medical record number, it'll have their date of birth and their weight. Weight is very important. And it might have diagnosis. A lot of times they call them hospital problems, and they don't call it a diagnosis, and they don't necessarily know the diagnosis right away. Are we for sure that this patient has multiple sclerosis? No, here's all of their symptoms, okay? So then when testing gets done, then they can figure out what the patient has and give them an actual diagnosis. So the date is on there, the time, and then it'll also have any drug allergies that they have. So NDA means no drug allergies, or NKDA, which is no known drug allergies. Okay, so sometimes they will list other allergies though, like if the patient is allergic to, say, strawberries, or if they're allergic to, I'm trying to think of something like bee venom. Okay, bee venom can cause an anaphylactic reaction and that can kill the patient. So hopefully they're not going to get stung by a bee while they're in the hospital, but it's still important to know and have that on there. So now we're going to have the date, the time, Lasix 80 milligrams by mouth twice a day, digoxin 0.125 milligrams by mouth every day, and Slow-K 10 milliequivalents by mouth twice a day. Okay, so we need to talk about something here. What's the difference between Q6 hours versus 4 times a day? If they do it every 6 hours,
Still 24. Whatever.
they're still getting 4 doses in a day, aren't they?
Yeah.
Yes.
Okay, so what's the difference then?
I see there's no difference.
This would be the time they started.
Yes, it has to do with time, exactly. So if it's every 6 hours and they start at 9 a.m., then they're going to take the next one at
3 o'clock, which is 16.
4.
3 p.m. So if they take it at 9 a.m., 3 p.m., 9 p.m., and 3 a.m.
Mhm.
Wait, I'm missing something here. 9, 3, 9, 3. Yes, okay, so 9 a.m., 3 p.m., 9 p.m., and 3 a.m. Okay, so their doses are going to be 0900, 1500, 2100, and 0300. So that's exactly every 6 hours, right?
Mhm.
Okay, so how about the blood levels of the drug in the body? If they take it 4 times a day, they could take it at 7 a.m., noon, 4 p.m., and then maybe 8 p.m. because they're in the hospital and they're probably going to get a sleeping pill and go to bed early. So between 7 a.m. and noon, that's only 5 hours, right?
Mhm.
Between noon and 4 p.m. is 4 hours. And between 4 p.m. and 8 p.m. is 4 hours. So are they getting it every 6 hours here?
No.
No.
And then between 8 p.m. and 7 a.m. is 11 hours, right? So that's a long stretch overnight. So the thing with every 6 hours is that if people want to sleep more than 6 hours, it's really hard to follow that every 6 hour schedule. And they end up being woken up in the hospital to take their medications, right?
Mhm.
Depending on when they start them. Okay, so the every 6 hours is more exact and it gets better blood levels in the body. Now, if the patient's on an IV, a nurse can come in and switch out the IV to a Y site without even really waking up the patient, right?
Yeah.
If they're good at it, if they're ninja nurses, they can come in and switch out the little IV bag and they don't even know that they've gotten a new IV bag. So, but you usually do wake up the patient and let them know what's going on, right? Maybe. If they're a baby.
If you have to, you have to, right?
Yeah. Okay. So then on page 139, it shows the stock bottle. Okay, so the stock bottle is the actual bottle of drug from the manufacturer, and it has to have certain information on it. Here I've got my generic ibuprofen from Walmart. You know it's from Walmart because it's got the little sunshine on the back. Somewhere there. Where is it? There it is right there. And then it also says Equate, which is their generic name, right? So this is over-the-counter ibuprofen. The stuff is going to be, the information is going to be the same either way. It has an NDC number. Let's see if you can see that. Okay, so the NDC number is the National Drug Code. And every drug sold in the US has to have a National Drug Code on it. Trying to see if anybody else came in late. I don't see anybody else. Okay, so the National Drug Code has 3 sections. So in this case, it's 49035, 604, I'm going to have to do what I do at work when a number is too small to read. I take a picture of it, and then I enlarge it, and there's the number 85. I couldn't tell if that said 85 or 05 at the end. I have a pharmacist that's even older than me, and the first thing I did, the first time that I took a picture of, it was a teeny tiny glass ampule of a drug. It was epinephrine, and we could not tell if it was expired or not. And so I held it very still. I took a picture of it and I enlarged it on my phone, and she was amazed. She says, "Oh, that's so clever." And I didn't tell her that I learned that from younger technicians. Didn't think of that myself. Okay, so the way this is, it's 5 digits, and I can't even write now. It's 5 digits, 4 digits, and 2 digits. Now this doesn't have 4 digits here, does it?
No.
So we're going to use a leading 0. If we were to put it on, say, an insurance form or some official ordering system, we would put a leading 0 in any sections that don't have the correct number of digits. So for instance, Teva is 93 here. This is the manufacturer. This is the drug name, strength, and form. And this is the package size, or the way that it's packaged. So in this case, 85 must mean 250 tablets, okay? But this isn't like all 85s, or it doesn't mean 250 tablets. This is always the manufacturer, and this manufacturer is who? Let me see if I can find it. It says distributed by Walmart. I don't believe it's Walmart. Did you know that most medications that you buy over the counter have their information on the back of the label? Way down in the bottom here, it'll say peel here. And then you get all this information that you couldn't see before. And it still doesn't tell me who the manufacturer is or where it's manufactured. So it just says distributed by, in Bentonville, Arkansas. I've been to Arkansas, but not Bentonville. Okay, so whoever that manufacturer is, they have an NDC number assigned to them by probably the FDA of 49035. So for this manufacturer, 0604 means ibuprofen, 200 milligram tablets. And 85 means 250 tablets. Okay, so anything that they get from that same manufacturer is going to have 49035 at the first part, but the rest of it will be different. So if somebody else makes ibuprofen 200 milligram tablets, they don't have to give it the 0604 designation, because they're going to come up with their own number for it. Okay, does that make sense? Mm-hmm. Okay, so on page 139, it says that the label on the stock medication bottle identifies the drug within the container. It also indicates the important information needed in bold to dispense the drug as follows. The generic name, the trade or brand name, if it's a brand name drug. Now this one does not say Advil or Motrin on it. However, right here it says compare to Advil tablets active ingredients. Can you see that?
Mhm.
So it's telling you that you're supposed to pick it up and compare it and try it if you want to, because they're both ibuprofen 200 milligram tablets. The NDC number is the 10-digit 3-segment number that identifies the manufacturer or labeler, the product, and the size of the container. So it doesn't mean like how many inches this container is. It means how much is measured in that container. The dosage strength is the amount of active medication found in the medication, such as micrograms, milligrams, grams, grains, units, or milliequivalents per dosage form. The total quantity, the dosage form, the name of the manufacturer, or in this case, who it's distributed by. And then I could technically call Walmart pharmacy and find out who makes this for them if I wanted to. Or I could probably just Google that NDC number and they might be able to tell me. Special instructions for mixing or compounding if indicated by the manufacturer, storage requirements of the medication, the lot and batch numbers or control number of the medication that can be used for identification if the medication is recalled. So it's used to identify a drug that's been recalled. So back here, right down there in the little black box, I have the lot number is OAE 3280A. And the expiration date is 10/20/21. Okay, so the lot number, I don't even really know what that means. It could mean the facility that was manufactured in and the date and which stuff they used to make it, like the actual ibuprofen powder that they used to turn into a tablet. What is that lot number? And this might tell me that information. And this is the expiration date. Now, does that mean that the 1st of October, I can't take it? I can't take this medication, it's October 1st already.
No.
No. Okay, so it's good till 10/31/2021 at 23:59:59. So like basically it's good until midnight on that day. Okay, and the way that we usually print it is 23:59, which means, you know, 11:59 p.m. Now it's expired 1 minute after that. Okay, and then the controlled substance indicators as appropriate is indicated by a large C with the schedule numbers in Roman numerals within the C. So let's say that you've got a C5 drug that's not extremely addicting, then it would have something that looks like this. And they do it in Roman numerals. So basically, a C2, C1 has no legal use in the US. It could be used for research purposes, like they're doing, one of these drugs is LSD. And they're still, you know, 40, 50 years after they first started working with it, they're still doing research on it. They still think that maybe there's something they can use it for. And still marijuana is a C1 according to the federal government, even though many, many states have legalized it and even put it over the counter. So it doesn't require a controlled substance. However, if a drug company takes the cannabidiol that's inside the marijuana plant and extracts it, puts it in a liquid form, then it becomes, it's either a C4 or a C5. C2 are the strongest that you can still get, and you can't have any refills with a C2 medication. These are things like Dilaudid, morphine. They moved Norco and Vicodin up to a C2 a few years ago. They used to be a C3. C3 The doctor can write for up to 5 refills, but they have to get it within 6 months. After 6 months, the prescription expires. C4, same thing. C5 has no limit on the refills, but again, they have to get it within 6 months. Okay, so C5 are things like some cough syrups that have small amounts of codeine in them. Or it could be Lomotil, which is a drug for diarrhea, but it makes people, it almost acts like a muscle relaxant because it slows down the motility in the GI tract called peristalsis. It slows it down so that the waste product doesn't move through the lower intestines very fast. But because it slows all that down, it tends to slow everything else down as well, and patients get very sleepy and groggy, and you know, for some people that's sort of a high. So they made it a C5. All of the benzodiazepines are C4s. So benzodiazepines are things like Valium, Klonopin, there's like 20 of them, and now all of a sudden I'm not thinking of them. Sinequan, which I always remember, but nobody uses it anymore. Ativan, Xanax. Manny, stop that. You know how dogs will take a blanket with their paws and they'll move it around till they get it where they want it and lay down on it? He's trying to do that on the couch, but there's no blanket on the couch. He's just scratching the couch. Okay. Okay, he got down. He's going to go lay over in his bed because I told him not to do that to the couch. Now he's mad and he's going to go lay on his bed. Okay, so all of these are C4s and they're relaxants. There's 4 uses for benzodiazepines, but that's not this class. So, okay, so we've got these 3 pieces of information when we fill prescriptions or when we fill a drug order in the hospital. We have the stock bottle. We have the prescription or drug order. And we have the dispensing bottle, which goes to the patient. And by law, they all have to have different things on them. It's not that important for us that we're able to read in math, in this particular math class. We're not going to be working a whole lot with the dispensing bottle, what goes to the patient. We're mainly looking at how much we're giving the patient, how they take it, and how long it will last them. Okay, so we're looking at days supply. We're looking at prescriptions, and we want to be able to read the stock bottle. So if you look on page 140 and 141, these are labels from stock bottles. Okay. So let's go down to page 140, practice problem C. We're looking at Glycet. Glycet is Miglitol. And honestly, I don't know what that is. I don't think I've ever dispensed it to anyone. So I'm going to get out my drug reference for health professions. I'm going to look up Miglitol, M-I-G. I'm in the L's. Anybody have any questions on this so far while I'm looking this up?
No, thank you.
Okay, so here it is on page 932, and it shows me Miglitol, which is a generic name for Glycet. It has a pregnancy risk category of B. It's an anti-diabetic agent, an alpha glucosidase inhibitor. So it delays the digestion of ingested carbohydrates into simple sugars such as glucose. Okay, it's a diabetes drug, good to know. And it comes in 50 milligram tablets. So reading this label, who is the manufacturer of this medication? It's up at the top of the label.
The NDC number?
Nope, the manufacturer,
Pfizer.
Pfizer. And what is the NDC number on this container?
In the middle on the top.
It's the one that starts with NDC at the top?
Yes.
0009
Uh-huh,
1301.
good. And then what is the trade name for this medication? What's the brand name?
Brifet?
Oh, it's SET, not CET. Good to know. And what's the generic name?
Maglitol?
Miglitol.
Yep. Maglitol. And what is the strength of the medication?
50 milligram.
50 milligrams per what?
Tablet?
Per tablet. Okay, because you want to be careful that you put per tablet, because sometimes if it was a liquid, it might be 50 milligrams in the whole bottle or 50 milligrams in each milliliter.
Normal.
So
Yeah.
in this case, it says tablets, 50 milligrams. So when we're answering a question, what's the strength, we're going to put 50 milligrams per tablet. And how many tablets are in the unopened container?
100.
100 tablets. Okay, so that's how you do those problems. And then when you go to your post-test, it's going to be very similar to all of that, okay? At the very end of the post-test on page 148, there's some review of all of this. One of the things that it says on page 148 is the generic name for the medication should be written in lowercase letters. And the trade or proprietary or brand name will begin with a capital letter. So you're going to capitalize it, and may be followed by the R symbol. So if I look back over to that page again and look at the label, it
Yeah,
says
they-
Glycet with that little R
Capital.
with a circle, right?
Yes.
So what does the R mean?
Good question. What does it mean?
Yeah.
It means, it doesn't even look like an R. Registered trademark.
Okay.
Okay, so it's registered as a trademark with the US Trademark Office or something like that. And it might also say TM, which is the same thing.
Okay.
Okay, does anybody have any questions on chapter 7?
No, I think I'm good.
Yeah. When it comes to the homework, do we write like the patient's name, or like do we make up names, or you just want to leave it blank?
Okay, so it's asking you, I want you to read those and interpret, show the direction. So it says on page 142, interpret the following prescriptions or medication orders and show the directions as they should appear on a prescription label. If the prescription calls for the liquid form of a medication, use the metric system and assume that a dispensing utensil is provided. So you're gonna assume that they're gonna give mom or dad, you know, something like this so that they can measure milliliters, okay? So
Okay.
if it says 1 teaspoon, you're going to use the metric system and you're going to say 5 mLs, and you're going to assume that they're going to get, this one's only 3, but you get the idea that they're going to get a 5 milliliter measuring thing.
Right. Thank you. Okay, I get it. Thank you.
Yeah. So they don't want the patient name, the doctor name, or any of that you know, you don't need to put that on there, just what they're asking for. Look on page 145, number 7. Okay, so this Lawrence Mary, MD, in Holly, Georgia, wrote a prescription. We don't know who it's for because he didn't write the patient name. It's for Ocuflox ophthalmic solution. What kind of drug is that? I mean, what is an ophthalmic solution? Where does it go?
Eye.
It
Your
goes in
eyes.
the eyes. So these are eye drops, and 5 mLs means it's a teeny tiny little bottle that only has a teaspoon of drug in it. And what does that SIG say?
1 drop.
1 drop each eye.
Each eye 4 times a day for 5 days.
Exactly. So what is the verb we're going to use for eye and ear drops?
Put.
1 drop.
No, it's not put.
They be placed or dispense or
Okay, what does it say on the board?
Place or instill.
Yes. So you're going to put instill 1 drop, or sometimes patients don't know what that means. So more and more pharmacies are now using the word place. Place 1 drop or 2 drops. So this is your interpretation would be place 1 drop into each eye. Okay, so place 1 drop into each eye 4 times a day for 5 days. Now, when we dispense an eye drop or an ear drop, on that bottle that we give the patient, or it could be on the box that the bottle comes in, because sometimes those bottles are super tiny, we're going to also put these auxiliary labels. And the auxiliary labels are going to say things like, do not touch dropper to eye. Okay, because if they touch the dropper to the eye and they have an eye infection, then they're infecting the whole bottle of solution with whatever's in their eye, right? So it contaminates it. And at the very least, it makes it degrade faster. So they want to make sure that they don't touch the dropper to the eye. If they're putting it in the ear, that's not so much of a big deal. You know, you can kind of rest it on the side and drop it in the ear, but not in the eyes. Can you use eye drops in the ear?
no. Maybe.
Yes. I mean, not eye drops.
Yes, eye drops can be used in the ear if the doctor tells you to, okay? So I'm not saying go get some eye drops and put them in your ear. They can prescribe eye drops to be used in the ear, but ear drops
Cannot.
may not be placed in the eye. Why?
It might have some different type of chemical that can hurt your eye.
What?
Yeah.
Is it what, thicker, oily, or I don't know.
There's those 2 considerations. What's the other thing? Remember how we said you don't want to touch the dropper to your eye because it can contaminate the bottle?
Yes.
Okay, eye drops have to be sterile when they're first made.
Okay.
Ear drops don't have to be sterile.
Okay.
Because they're okay, so we have an eardrum. If the eardrum is pierced, technically it could follow the auditory nerve up to the brain, but most of the time eardrops aren't going to get systemically into the body. Eye drops going into the eye are attached systemically. I mean, they not attached, but they can get into the rest of the body. Especially since our tear ducts drain into the back of our throat and go down our throat. So, you know, your ears don't, yeah, there is a eustachian tube that goes between the ear and the mouth, but usually the eardrum protects the inner ear from anything that's in there. So if they have a ruptured eardrum, that's a whole nother story. But for most cases, eardrops don't have to be sterile. And they may contain something like hydrocortisone, which is HC, or a numbing agent, or some alcohol, or carbamide peroxide. So we don't want to put any of that in our eyes. Does that make sense?
Yeah.
Okay, good. All right. Any other questions on chapter 7?
No, but
No.
I want to ask about the homework of chapter 6. Should we do all the post-test?
How much is the post-test?
Let me see.
What do you mean? It's not that long.
Not that long, yeah. It's
Yeah,
30.
it's only
30
30
question.
questions. Yeah, go ahead and do all of it. In fact, we did a couple of them already.
Right. Thank you.
So I already did 2 of them for you, so, or you did them with me, so you really only have 28 to do.
Okay, and we will do also the post-test of chapter 7.
Yes, all of these chapters, you're going to do the post-test.
Now,
The only difference, there's like a couple of things on chapter 17 that I'm not going to make you do, and I'll tell you what those are when we get to chapter 17. I've always done chapter 17 in the front. I've front-loaded it because it's all basic math, add, subtract, multiply, divide. But what I found out was that it scared some people away because it's business math. And I understand, I do not like accounting, I totally get it, but, and thank God I married a businessman, so he does all of that for me. But I've decided this semester to put it at the end, so we're gonna see what happens. My students last semester found 2 answers wrong on examples of chapter 17. So it'll be interesting to see when we get there if you guys find those same answers wrong. And I also, you know, I told you I emailed the author of the textbook, Elaine Veal. She didn't write the key to the textbook. So, you know, she didn't realize that those answers were wrong either. So first I sent her a fan letter telling her how much I loved her book and the way that she wrote it and everything. And then she answered me back and asked if I had found any errors in her book. And I said, no, but my students have. So that's really cool. And I told her where they were. That I found, my students last semester found 3 wrong answers, 2 of them in chapter 17. So that's interesting. And she thanked me very much. And she said that nobody had ever written her to tell her that. So, you know, textbook writers need this information. She's a pharmacist. So she's at a community college in Franklin, Virginia. And she teaches pharmacy technicians as well as nursing. She does their math classes for their nursing program as well. So that's pretty cool. So any more questions on chapter 7?
no, just to verify, chapter 6 is due next Thursday, correct?
Yes.
Technically, yeah.
Yeah.
Chapter 6 and 7 or only 6?
I put 7 as due next week as well, but I don't care if you turn it in a week later, a week after that. I'm fine with that. I'm leaving it open. Okay?
Okay, thank you.
You're welcome. I put due dates mainly to keep people on track. I'm not going to be like, you know, I already graded chapter 3, because you can see, I sometimes, when you send me your homework, I will sometimes correct something like, oh, number 3 should be whatever. But I'm not going to go through and grade them, put a letter grade on them, and hand it back to you, okay? I gave you the key. What I want to see is, do you know how to figure out the answer? So that's what I'm looking for, and that's why I ask you guys to show me your work. So chapter 7 isn't really going to have that kind of work anyway, and I'll actually be reading chapter 7 homework, okay?
Okay.
All right. Any other questions?
No, thank you.
Okay, good. So I'll see you next week then.
See you. Bye.
Bye.
Thank you. Okay.